So we're going to talk today about nursing homes. We're talking about nursing homes. And I'm Dr. Bernie Masseri. I'm a homeopathic practitioner. I'm in Gilbert, Arizona. I own Gilbert Natural Medicine. The website is gilbertnaturalmedicine.com. If you want to learn about what I do, that would be a great idea for you to go to the website. You can reach me at 480-703-0151. And if you want to become a patient or are a patient, I'm meeting everybody virtually online because of this whole COVID disaster. I'm a pretty outspoken person, and a lot of people don't know how to deal with that. So hey, that's just the way it is. And if you're going to hear my shows or watch my shows, realize that, I never mean any harm. I just tell it like it is. And if you can't deal with that, then, you might not want to listen. Okay, so we're going to talk today about nursing homes. And I did a wonderful radio show on Spreaker. So it's Spreaker.com. And my channel is, oh God, I don't know what my channel is. I'll tell you about that later. Anyway, I did a great show on nursing homes. And the reason why I'm exposing nursing homes is because I used to work in nursing homes. And I saw things that in my heart, they were wrong. In my mind, they were definitely wrong. In my knowledge of live and let live, oh my gosh, they're wrong. I just saw too much, And I know what it is to have a loved one in a nursing home. And when those lights go out at night or when they're all alone in the afternoon, you don't know what's going on with those patients. So that's the reason why I'm coming to you today with nursing homes. And I would like to do a follow-up to this video because I don't want to do, too long a video. You get bored, you tune out. What's the sense? So maybe 10 or 15 minutes today, another 10 or 15 minutes next time. We could cover the whole gamut of nursing homes and what they're truly all about. Now, not every nursing home I'm saying is bad because there are some really nice nursing homes. But I'll tell you what, they're far and few between, and you really have to search out what you're looking for if you're about to put a loved one in a nursing home. Do not put anybody in a nursing home because your friend says, oh, I have my so-and-so in a nursing home and they're really good. How do you know? Did you check them out? Did you go and investigate? Did you show up unannounced? Oh, they hate that. They hate when somebody shows up unannounced and says, can I look through your nursing home? Because I have somebody I would like to place here. They're going to tell you, well, let's set an appointment, so they're going to bring you in at the best possible time when they know the rooms have been cleaned. So housekeeping did their job. Nobody's sitting in their own feces. Everybody's been changed. Nobody's in the hall taking showers because showers only happen at 5 o'clock in the morning. Or worse, right after breakfast when you have to go potty. There's so much that you don't see about nursing homes, like the shower rooms, like the cafeteria during feeding, like what happens in the morning when they get somebody up at 4 a.m. and dress them in everything, including their shoes, and put them back in bed and cover them until 6 o'clock when they come back and they get you up and they drag you off to the cafeteria for breakfast. Would you want to get dressed and put back in bed with your shoes on and everything for an hour and a half till somebody finally comes for you and gives you breakfast? What a horrible feeling. What a cold, horrible feeling. Where do I start? I guess I start from the beginning. I guess today's show is going to be about how to check these places out. And then tomorrow we'll get into some of the more fascinating episodes that happen in nursing homes. So you pick a nursing home. You're thinking maybe it's okay. You got to put somebody in there. So you make an appointment to go see the nursing home. And you're going to see exactly what they want you to see. Clean halls, no smells of urine. You ever walk into a nursing home and you smell urine, you better hightail it out of there real quick, because that's not the place you want to put someone in. They're going to tell you, sure, come on in, when the person has had lunch and they're feeling fine and they've been put down for a nap and everything is quiet. So quiet. Nobody's yelling and screaming like you usually hear, especially on the Medicare wing, where they can't afford out of pocket. So they're on Medicare. So you know what's happening. They put the worst case scenario on Medicare wing. And you're going to hear yelling and screaming and all kind of things in those nursing homes. But they're going to bring you in when they know it's the best hour to be quiet and to see what you're looking for. So maybe you will choose them. That's why I say, if you take that kind of a tour, go back unannounced. Go through that place again where they don't expect you. Pretend like you're visiting someone, or go visit somebody you know in a nursing home unannounced during an off time. You'll see some stuff. You might see patients with black eyes. You don't know if the nurses did it or not because nobody's going to tell. Lots of things. Again, if you smell any odors, it's either urine, they haven't mopped, the beds are soaked, or they're laying in their own feces. If you see someone with their food on a tray on the side of the bed and it's not feeding time, it's because that patient was left to feed themselves and they never ate, or they did eat, and the trays were not collected. And most of the time, you will find that tray covered up because the patient did not have what it takes to feed themselves. So there should have been someone in there feeding that person, but there wasn't. Why? Because there's not enough CNAs to go around, not enough people to go around to help the patients. Another wonderful thing about nursing homes are the nurses that pass out the med carts, the meds on the med carts. It's not the RN. It's usually an LPN, a licensed practical nurse. Well, nowadays, anybody can be an LPN. Okay. Here's how they pass out the meds. Would you do this to yourself? Would you do this to anyone in your home? Supposing there's a nursing home, supposing there's a patient in a nursing home that has to be on 5 or 6 or 10 different meds. Who knows? They put them all together in this little white cup. All together. They bring it to the patient. They put it in the patient's hand to be self-administered, because they're not allowed to put the pills in your mouth in case the patient dies. You're not liable. They take that little white cup and put it in the patient's hand. And if the patient doesn't know what to do, they will lift your hand to your mouth, shake out those meds, swallow them down, buddy. All of them at one time. How do you know that one of those meds is not going to combat another med, that one of those meds aren't going to mix with the other meds, and you're going to have profuse diarrhea, or you're going to have vomiting, or you're just going to be miserable because you took too many pills at one time? That's what they do. God forbid you should vomit. You know, you're going to have to sit there in your vomit until somebody takes the time to walk down the hall and say, "Did you need something?" You know, is it because you can't function anymore that they just don't give a damn? Is it because you're just too old and you're most likely, you know, like senile or something, or you have a bad condition, you can't function on your own, that they just kind of brush you off to Buffalo? Where are the people with compassion? Where are those nurses and CNAs and people that are supposed to be in scrubs doing their job? Where is the compassion? They take seniors and brush them off to Buffalo. whether you're in a nursing home or not. So let's be concerned about giving our hearts out to the elderly who know a hell of a lot more than you do because they've lived longer and they've gained more wisdom. And just because they lose some of their mental faculties doesn't mean they don't know what's going on. They know what's going on. Or you'll find a nurse sitting on the edge of the bed or standing up near the bed trying to feed someone who can't swallow real well. So they're spitting out most of their food. Or you will find in the cafeteria someone that's been so heavily drugged that they're actually asleep in their food. Asleep with the head down on the table. When that patient should be in their bed, they drag them off to the cafeteria and leave them there and expect them to eat. And the food, that's another thing you want to check on. The food. Make sure it's not slop. Make sure it's nutritious. You know, there's dietitians in those places, and they should have the right menus. But sometimes they don't. And sometimes the food is cold or burned, and the ice cream is melted, or the Jell-O. In a perfect world, we could take care of our elderly at home. We could have some help. I don't suggest you be a sole caregiver to someone that can't take care of themselves anymore, because that'll kill you. I mean, that's a 24/7 job on its own. That will kill you. You can't be a 24/7 caregiver. It's just not your thing. You're not built for it. You're not there. You're not there mentally and emotionally and physically. You need help. That's why a lot of people end up in nursing homes. And God forbid you're not in a nursing home, but you end up in something worse, an elderly care home. We're going to talk more about that later in our next episode of Nursing Homes Exposed. This is Dr. Bernie. I am so happy to be with you. I am so happy that you tune into my YouTubes on health and wellness with Dr. Bernie. I am so happy that you can connect to Spreaker.com and go to Dr. Bernie Masseri and find all of my live broadcasts. Go to Dr. Bernie Masseri. Maybe you'll find me on Spreaker. Maybe you won't. I'll have more information on that later. 480-703-0151. If you want to ever contact me, again, I'm a homeopath. I do medicine. What does it take to get you to understand that alternative medicine really works better than any drug in your life? Because we cure people. Prescriptions keep you in the moment. They don't cure you. They keep you in the moment. Take care of yourselves. Wear your masks. Wash your hands. Stay out of public. Maintain your distance. And please, let's clean up this world. Again, Dr. Bernie Masseri. Love you guys. See you later. Thanks for listening. Hey, you know what? It's just that simple.